Should be able to identify atlas and axis, right? Atlas is C1, axis is C2. This is the dens of the axis. Of course, it goes like this, and so when you rotate your head like that, it rotates like that. Okay? As far as the thoracic vertebrae, let me grab a couple of thoracic vertebrae. Okay? So as far as the thoracic vertebrae, obviously, when you get a vertebrae, the spinous process here always points down. Okay, so when you get the vertebrae, don't look at it like this. Okay, it's like this. So if you know that this pointing down, this is the right way. That means these two on top are the two superior articular processes. Okay, you can see the two transverse processes here, right? We talked about the spinous process. So the two going down, you see these two there? Those are the two inferior articular processes, right? These two there. Okay. And then we talked about the body, vertebral foramen. Okay. And you can see how the superior articular process articulates with the inferior of the other, right? Superior of one articulates with the inferior of the other. Okay? And of course the hole here in the middle, right there, is the intervertebral foramen. Intervertebral foramen, where the nerves come out. Okay? Now you also need to know about lamina, pedicle, and neural arch. Okay? So when we talk about a neural or vertebral arch, okay, it goes from here all the way to here. Okay? So from here all the way to here. That's one arch. This is the other arch. Okay? So this is one arch from here to here to here is the other arch. So imagine the transverse process separates that arch to a back half and a front half. Okay? So the transverse process separates it from a back and front half. The back half from here to here would be the lamina. From here to here would be the pedicle. Okay? So again, it separates it in half. Here to here, the back half is the lamina. From here to here would be the pedicle. Okay? So that's most things you can find on this. As far as the sacrum goes, I mean, this is the front, this is the back. Obviously, if you look on the skeleton, you can see, right, this is the back, right? So looking at it from the front, it would be like this, right? Okay, that means the holes in the front are the anterior sacral foramen. The holes on the back, same holes, but they're called the posterior sacral foramen. Now, you can see if you look at this, you can see where the hip comes together with the sacrum in this area right there, right? That's this area right there. That's a sacral iliac joint, okay? All right? And then you can see on this side, right there, that's this area right there. Okay, so that's a sacroiliac joint as well. As we'll learn later on, this is the ilium. So where they come together, that's why it's called the sacroiliac joint. Okay? Does that make sense? Yeah. Okay. All right, so let me go do the last group.